Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources. Welcome to today's edition of Helping Seniors Television from the Helping Seniors Network. Whether you are caring for a senior, are a senior, or just plan to be one, we hope you'll enjoy today's program. Dr. Jason Garlington, fellowship-trained cornea specialist and glaucoma, cataract, and refractive surgeon with Eye Institute, visits with Helping Seniors TV host and longtime senior advocate Joe Steckler. The topic in today's episode is cataracts. Dr. Garlington performed a successful cataract surgery for Joe, and today, with footage from that surgery, they discuss the procedure.
Welcome to this edition of Helping Seniors. Today, you're going to see the actual performance of cataract surgery. And the doctor with me, Dr. Darlington, Dr. Jason Darlington of the Eye Institute. Welcome, Dr. Darlington.
Thanks for having me.
Dr. Darlington is the surgeon that performed the cataract surgery on me, and I asked him if we could film the surgery so that more of our viewers could see how simple cataract surgery is and why there's a need to not be afraid to have it done. And I have admitted to you, Dr. Darlington, that I should have had my eye surgery years ago, but I heard things that scared me, and therefore I did not have the surgery done. But our viewing audience today, I would like to do some very simple lead-ins to the surgery. We've got me going into the clinic, and we'll backfit all this in and produce a show. But you and I are going to talk about some simple things about cataract surgery, and then you're going to describe the eye operation, and then we'll make a 26-minute film out of it and put it on for you viewers to see. You'll see some of what Jason and I are going to talk about in the studio here today, but then you'll see a completed product. But first, let's just talk about, Dr. Darling, what is a cataract?
There are two structures in the eye that help bend the light and focus the image so that it lands on the retina. The front cornea, it's a clear structure in the front of the eye, and then there's a lens inside of the eye. So the lens inside of the eye helps about 2/3 of the focusing ability of the eye itself to get that image to focus onto the retina, and the retina is like the film in the camera. It picks up that image and sends it to the brain. When we're born, that lens is perfectly clear. And as we age, that lens, through continuous UV damage and sunlight, it slowly continues to cloud and get darker and darker and darker, and it causes a degradation of the vision. Most patients will start to notice this degradation because maybe their glasses have been stable their whole life, and then their glasses start to change. They will start to notice more glare and halos at night, especially with oncoming headlights. When the oncoming headlights hit a clear lens, it just goes through. When it hits a cloudy lens like a cataract, that light gets scattered, it washes out the image. And so folks with cataracts will start to notice that they feel less and less comfortable driving at night. They can't see freeway signs as well. They need to get closer to the road signs to see them.
When you see 6 headlights instead of 2?
Sometimes, yeah. Sometimes you look at a light and you just get the scattering or lines coming off. And so, there's different kinds of cataracts, and they can manifest in different ways. But most patients will notice that their nighttime driving becomes impaired. Reading starts to become more difficult and need more light to read. And eventually folks get to the point where even with new glasses, they're just not comfortable with their vision. It starts to affect their activities of daily living, such as night driving and reading. And that's usually when they'll come to see me and talk about ways other than glasses that we can help their ability to function better.
Okay. Then what are some of the symptoms? Besides that, that's really, does that constitute?
Yeah, the symptoms are usually nighttime glare, nighttime halos, difficulty reading, continuously changing glasses,
okay.
And sometimes new glasses don't help with the vision anymore.
Okay. Why is it, or is it necessary to remove a cataract? What happens if you don't remove it?
Well, The cataract does not damage the eye. The cataract just blocks or reflects the light and no matter what pair of glasses we put in front of an eye with a cataract, the image still has to pass through that cataract to get to the retina. And so even if you have a perfect pair of brand new glasses, because the image has to go through the cloudy cataract, it still results in a cloudy image that you see.
Okay.
And so, I tell all of my patients, no one has to have cataract surgery. Cataract surgery is an elective procedure to improve the vision. But most patients want to have cataract surgery because if you want to be able to maintain your driver's license, if you want to be able to maintain, to operate a motor vehicle safely, if you want to continue read, then oftentimes it's necessary to get that cloudy lens out and to get a perfectly clear lens in to improve the vision. And most of my patients are amazed at how much vision they've lost once they get that new lens in their eye. Colors are more vibrant, things are brighter. Oftentimes patients will come and tell me, oh my gosh, I didn't know what color my walls were. I thought they were beige, they're white. And so, it really helps with color accuracy.
So really, I was going to ask you, what are the dangers of not having surgery? There's really no danger except, well, there is a danger. If you, in my case, the Department of Motor Vehicles restricted me from driving at night because of my cataracts.
That's correct.
So the dangers are there. And if a person drives a lot at night and you're at a point where you don't have to go get your license checked, there's nobody to check you except yourself. So you're not only a danger to yourself, you're a danger to the other people on the road.
That's right. And sometimes some folks don't realize how poor their vision is because it happens so slowly, so gradually that, the vision seems the same today as it did yesterday and pretty much the same as the day before. And they don't notice that the visual degradation. And sometimes what will bring them in is they'll go to the DMV and they'll try to pass the vision test and they won't pass. And then they'll go to get a new pair of glasses and they'll be told that the glasses don't help. There is no pair of glasses that will make the vision any better. And so if they want to maintain their ability to drive, then they need to get the cataract out. And so, do they have to have surgery? Only if they want to maintain their driver's license. And so, but most patients want to, function at a good level. And so most patients are able to, get over any fear they may have about cataract surgery. But I think more people are becoming better educated. Most patients have friends or loved ones or family members that have had cataract surgery, and cataract surgery has advanced so much, even recently, that most patients feel pretty comfortable with the experiences that they hear from their friends and their family members. They go ahead and just have it done.
Okay. In a show you and I did on glaucoma, we talked about the fact that during eye surgery, like for cataract surgery, you could do a procedure at the same time for glaucoma treatment.
That's correct.
But what are some of the other things that you can do? Like when you remove my cataracts, you put lens in my new lens. Explain to our viewing audience, what are some of the other things that you can do at the same time you do the cataract surgery, and they're going to be amazed at how long it really takes.
So when we are replacing the cataract with a clear lens, we can modify how the optics of the eye, modify how the system works. And so for patients that have maybe worn glasses their entire lives, the reason people need glasses is because the combination of their cornea and their natural lens is not getting the light focused onto the retina. And so they need glasses to modify that system so that the image does land on the retina. When I take that cataract out, we have very accurate ways to determine which lens will get the light focused onto the retina. And so people that have worn glasses their entire lives, oftentimes we can reduce or eliminate their need for glasses depending on which lens that we put in. For example, if you're nearsighted or if you're farsighted, then when we do cataract surgery, we can put in a basic lens and we can reduce your dependence on distance glasses. You may wear readers, but reduce your dependence on distance glasses. For people with astigmatism, there's a special astigmatism. It's called a toric lens. So I can put a toric lens in the eye, and instead of needing glasses to neutralize the astigmatism, I can use the special lens implant to neutralize the astigmatism. And so for patients that have had astigmatism their whole life and always needed glasses to neutralize that astigmatism, with this special lens implant, they can now see at distance without glasses. They'll still need reading glasses, but see at distance without glasses. There's also specialty high technology lenses that we can implant. So if the eye is otherwise healthy, then not only can I neutralize the astigmatism with these high technology lens implants, but we can regain the ability to have extended depth of focus, which means that not only can patients see at distance, but they can also see at intermediate and near. So when patients receive these extended range lenses in their eyes, they can see to drive without glasses, they can see the dashboard without glasses, and they can see to read without glasses.
I can't see the dashboard without glasses yet. I haven't. I tried it. That's why I think I got to get my glasses checked. But we can put lens in, and that can be done during the cataract surgery. But if a person needs if you have a cataract surgery or a cataract, and I have been given to understand that there are some other things like that. You might have to replace the cornea or the retina or something like that.
So depending on the complexity in the eye disease, there are other procedures that we can combine with cataract surgery. So oftentimes patients with glaucoma, at the time of cataract surgery, I can do a micro-invasive glaucoma procedure. And so through the same micro-incisions, through the same 2 millimeter wounds that I'm already going to create to perform the cataract surgery, I can implant a device to help lower the pressure and maybe reduce or eliminate the patient's need for glaucoma drops. I can unroof the natural drain and help reduce or eliminate the need for glaucoma drops. Sometimes I will do cataract surgery and at the same time create a completely new drain, depending on how advanced the glaucoma is. There have been times where patients have corneal disease, and so both the cornea and the cataract are limiting the vision. And so in some of those patients, I can replace the back of the cornea and replace the cataract all at the same time.
Okay. Would replacement of a cornea or a retina, that would be a more extensive operation?
It takes a little bit longer to perform because we're doing more.
You wouldn't
more
do
procedures.
that at the same time you did a cataract surgery.
I can do a cornea replacement at the same time as the cataract. Yes.
So if in my case, when you took the cataract off, if you saw, what would have been most likely to have been damaged, my retina or a cornea?
The most likely damage would happen to the cornea because the cornea is right in front of the cataract. And so we're in there with the instruments removing the cataract. The endothelium, the very back layer of your cornea, is the closest structure. So that sometimes can become damaged. Very rarely, and usually the only time that damage occurs to the cornea is in people that have something called Fuchs dystrophy. They have a cornea condition where the cornea is already weak. And so if you go into the surgery with a barely functioning cornea, then the cornea may sustain a little bit of trauma that a normal cornea would shrug off. A normal cornea would be able to heal from. And if you have a weak cornea with Fuchs dystrophy, it may not be able to heal from it, and then you may need a cornea procedure.
Wait, what is the condition that where you have a back of the? Is it the back of the cornea where the I don't know what you call it, washes off?
That's the Fuchs dystrophy. Yeah, the Fuchs dystrophy is when the endothelium, the back layer of the cornea, is dying at a slightly higher rate than average. And so what we think about the way the cornea works is we all have endothelial cells in the back of our cornea. The endothelial cells are derived from neuroectoderm, same tissue as the brain, so we can't regrow that tissue. And so when the tissue becomes damaged, we can't replace it, and the cornea starts to swell. And that swelling will limit the vision. And so that structure, usually during cataract surgery, we will lose a few endothelial cells during the procedure, but most of us have ample supply of those endothelial cells. So if a few of them die off during cataract surgery, it's not a problem. The cornea can still heal and you still have good vision. But for folks with Fuchs dystrophy, where there's a limited amount of those endothelial cells, losing a few more during cataract surgery could make the difference between the cornea being clear and not clear, and that can lead to possible more cornea surgery.
But when you get in there, and you can actually see these, if something needs to be replaced or fixed, you can see that, right?
We make that determination before the surgery.
You do?
Yes. When I go into a cataract surgery, I know, is this just going to be a cataract surgery, or am I going to do a cataract surgery with a cornea procedure? I don't make that decision on the fly.
Okay.
Yeah, it's all planned.
What you're saying is there's almost anything today. You can almost fix anything with the eye. You can't undo what glaucoma has done, but you can fix so many other things.
That's true. So if you go blind from glaucoma, that cannot be cured. But we can try to prevent further damage from glaucoma. But the neat thing about cornea surgery, the front clear part of the eye, is we can reverse blindness with cornea surgery. So for folks that have maybe not seen for 10, 20, 30 years, if we take that cloudy cornea off and I can replace it with a clear cornea, and we can bring the vision back sometimes to 20/20.
You've had people that you've done that to?
Absolutely.
That must be an amazing feeling for you as a doctor to be able to restore somebody's sight.
It's very satisfying.
Yeah, I can
It makes
imagine.
a huge
That would be a
impact.
highlight of being a doctor. Yeah, because we don't think about that. I think of the world, the blind world somebody lives in, it's just like being in a room with absolutely no light. That's amazing. And if we're 65 or older, everything you and I have talked about today is covered by Medicare.
That's true. That's correct.
Okay.
Well, some of those specialty lenses do cost extra. So the specialty lenses, the specialty implants that we put in at the time of cataract surgery, the cataract surgery itself is covered by medical insurance. But if you want one of those specialty high technology lenses that give you both distance and near vision simultaneously, that technology does cost a little bit extra.
Yeah. But there are also good reasons, and you explained this to me, why you go with the regular lens and not a specialty lens. It depends on what a person wants to do. There's just so many things to talk about.
Yeah, and some folks, they have glasses, they like their glasses, they don't care too much about the specialty lenses, and they go ahead and get the standard lens. And there's other folks that love the idea of having less dependence on their spectacles for distance and near, and they jump at the chance at these new technology lenses.
Okay. I think what we're going to do now is we've sort of set the stage for the operating part, and what we're going to do, audience, is we're going to shift now to a monitor, and Dr. Darlington is going to describe on a monitor where we have a small eyeball, and we hope we'll get a larger one to put on it before we get to the actual viewing. But viewing, I don't like to use that word, viewing, but he's going to talk about what he did to my eye and how he did it. So here we go. That's me now. You're not going to operate on me now, though. We're going to get it. I'm going to watch with you. I also want to say, if you're recording some of this, Carrie, I don't know exactly how we'll fit it all in, but I didn't feel any pain at all.
So here we are in the operating room. You can see me to the right. There's the scrub technician to the left. And what I've just done is I've filled the eye full of air, and now I am putting a stain in the eye called trypan blue. This is an extra step that I don't often need to do during cataract surgery, but when the cataract becomes very dense, like yours was, it's harder to see the clear capsule on the surface. And so sometimes it's necessary, such as it was in your case, to stain that capsule with a blue dye. And that stain allows me to see the capsule better, because I need to open the capsule without damaging the capsule. Right now, I just put some gel on the surface of your eye. That keeps your eye from drying out. It prevents it from drying. I need your cornea to be nice and lubricated, and that helps me see through it. And so you can see that there's an air bubble in your eye. That stain has been sitting on the capsule, so it's stained it blue. And now you're going to see me fill your eye full of what's called viscoelastic. It's a clear gel. And so now the air bubble is mostly gone. Your eye is full of a clear gel, and I have something called a cystotome. It's like a small bend in a needle. And so now I'm starting to open the capsule. And you can see as the capsule opens that it's stained blue. And so I've gotten about 25% of the way. And so what I'm doing is I'm gently tearing this capsule in a circle. And as that circle travels around, I will end up with a round hole in the capsule. And so I've pulled that cystotome out, and now I'm going in with Utratas, which is a special type of forceps, and I'm finishing what we call the capsulorhexis. The capsulorhexis is the term for creating a round circle in the anterior capsule. So you can see I've completed the capsulorhexis. I've taken that capsule out, and now I'm using a what we call balanced saline solution. It's just a fluid, and I've irrigated some of the jelly out. And what I'm doing is I'm pushing this saline around the capsule, and it travels all the way around the capsule, and it separates the cataract from the capsule 360 degrees around. And so it makes it much easier to get the cataract out without damaging the capsule if the capsule has been separated. And so I use a fluid layer or a fluid wave to separate the capsule from the cataract. And so now that I've separated the capsule from the cataract, now I'm introducing a device. This is a device that breaks up the capsule, or breaks up the cataract and sucks it out. And so this device uses ultrasound, and so the tip vibrates ultrasonically. It's so fast you can't see it, but as it vibrates, it also sucks through the center of it. And so as it breaks up the cataract, it sucks it up through the inside of that metal tube. So it's using ultrasound.
So that's my cataract coming out through that tube?
That's your cataract. So you can see it kind of flipping and turning and breaking up into pieces. Yeah. And it's all leaving through that little tube in your that's in your eye there. And so
I don't remember any of this. I don't remember any of it.
And you didn't feel most of this because,
I didn't feel it. No.
Because you're awake.
No.
You're awake down there. You're breathing on your own, and during this process, you're probably seeing some lights. You're seeing you're seeing lots of colors. Sometimes you might feel a little bit of pressure, but you don't feel any of these incisions. It doesn't hurt. You're relaxed. We give you IV medication called Versed, so it takes some of that nervous edge away, and it makes it a not unpleasant experience during the procedure. Most people, think it's kind of neat to see all the different colors. And so I've finished taking the cataract out. It's already gone. Now what I'm doing is, usually there's a little bit of a layer after the cataract is removed, a hazy layer, the outermost part of the cataract that's still stuck to the capsule. So what this device does is it irrigates the eye, so it's pumping fluid into the eye, and at the same time it allows me to pull this last little bit of layer off the capsule. So all that's left is just a perfectly clear capsule. And so it's called IA, or automated irrigation and aspiration. So I'm just pulling the last little wisps of cataract out.
So then you haven't put the lens in?
Not yet. We've got to get the cataract completely out before the new lens comes in.
Okay.
And so you can see I'm finishing up, put a little more fluid on the eye there. So now that the cataract is completely out, cornea is clear, the capsule is clear, now I'm putting some more jelly into your eye. I want to fully inflate your eye. And as I put this new lens in, the amazing thing about this lens is this lens is, with the little legs that hold it centered, it's about 12.5 millimeters. And I'm going to implant this 12.5 millimeter lens through a 2 millimeter incision. So you can see I'm injecting the lens into your eye right now. And it's rolled up like a burrito. It injects through this 2 millimeter wound. Now that it's in your eye, it's unrolling and expanding, and it's going to be 12.5 millimeters. And so now that the lens is inside of your eye, it's inside of that capsular bag. Now what I'm doing is I'm going to remove all the viscoelastic from your eye. And so I'm going to take out all the clear jelly that I just added. And all that's going to be left is your clear capsule.
So you're taking all the jelly out of there now?
I'm evacuating all the jelly. Yeah, we don't want to keep the jelly in. Now that I've got the lens in the eye, we don't need that clear jelly anymore. And so now I'm taking it out. So now I'm behind the lens, I'm in front of the lens, I'm getting all the viscoelastic out.
So you're almost finished, right?
We're wrapping up, yeah.
So then when you get all that out, then you don't stitch it or anything, you just...
We don't need to stitch, yeah. That 2 millimeter wound, I create it in a way that it's multiplanar. And what that means is, once I hydrate that wound with a little bit of fluid, it will self-seal. It seals on its own. We do not need a suture to keep that from leaking.
So there's enough pressure on the eye then just to keep the lens and everything stay in place. Mm-hmm. And that's why you don't want me to...
See, here I am right now. So right now I am hydrating that wound. I'm putting a little bit of fluid in there. So I refilled your eye full of fluid. I hydrated the wound a little bit. And now what you're going to see me doing is is I'm checking the pressure of your eye, making sure that it's not leaking, and then I'm going to use a little Weck cell, we call it, and I'm checking that wound, and I'm looking to make sure that it's not leaky. Here I am, I'm checking the pressure, I'm checking to see if there's any fluid. It was leaking just a little bit, so now I'm going to put a little more fluid in there, and then I'm going to check again.
So you're actually touching that right now.
But you can't feel it. Yeah, I'm touching the surface of your eye. You're completely comfortable. You're just looking
like
at all the pretty colors.
Is that what you're doing? Is brushing it?
Yeah, so I just wipe the surface, and I'm looking for droplets. I'm seeing our droplets of blood coming out. So there we go. We're all done. Your eye's sealed.
So my eyes all sealed up. That's it. And that's when you got up and walked away.
Yep.
You just left me there. Just left me there. You know, it's amazing what technology can do. And when I asked Dr. Darlington if we could film this, he agreed right away to let me do it. But I hope, maybe some of you have been frightened a little bit, but let me assure you, I didn't feel a thing. I didn't feel anything when they put the jelly in my, in fact, right before they operated on me, they opened my eye up with a clamp and they scrubbed my eyeball and I couldn't feel a thing. That's how effective it was. We're almost out of time. And anything that you would say to our viewers about cataract surgery?
I would just say that if you have a visually significant cataract, if it's bothering you, you should not be afraid of the surgery. It's very common, and people generally enjoy the benefits they get from cataract surgery.
Thank you, Dr. Darlington. Thank you, viewer, for watching. I hope you learned something. But I want to thank Dr. Jason Darlington for the super job he did on my eyeball, because I can see better. And I only regret that I didn't do this many years ago. And if Dr. Jason Darlington would have been around, I probably would have done it. But in your case, I didn't ask for a second opinion. I had enough confidence in him. Thank you, Jason.
All right, my pleasure.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.